My name's Mary Dixon, and I'm going to be talking about bacterial endocarditis today. I'm going to be talking about the symptoms, how a person gets it, what it's like. I have some pictures of what it looks like, and I'm going to talk about the microbiology aspect of it as well. What is bacterial endocarditis? Bacterial endocarditis, also called infective endocarditis, is an infection caused by bacteria that enters the bloodstream and settles in the heart lining, a heart valve, or a blood vessel. This is very uncommon, but people with heart conditions have a higher risk of getting it. How does a person get bacterial endocarditis? The infection can be caused by bacteria introduced into the bloodstream. Some ways that you can get it is from brushing your teeth. Some people with sensitive gums, they can brush their teeth a little too hard and it'll make their gums bleed, and then bacteria can get in that way. Also, people who have gingivitis, their gums are bad also, so this might be a higher risk for them. A scientific study showed that people with poor dental hygiene or who bleed during toothbrushing are at a higher risk of developing bacteria in their blood. There are many ways to diagnose this. One way is echocardiogram to view the valves of the blood flow through the heart, blood tests and cultures to check for bacteria and signs of inflammation, ECG to analyze the heart rhythm, chest x-ray to examine the lungs, cardiac CT if more information is needed about your heart, urine test to check for kidney damage, and MRI of the brain to check for brain damage. And I got this information from the Mayo Clinic website. The causative agent of bacterial endocarditis is Staphylococcus aureus, followed by Viridans streptococcus, and coagulase negative staphylococci are the three most common organisms responsible for bacterial endocarditis. And the type of agent is a bacteria. It says it in the name, bacterial endocarditis, and also Staphylococcus aureus is a type of bacteria also. There are many characteristics for bacterial endocarditis, a few of them being flu-like symptoms, a new or changed heart murmur, fatigue, aching in the joints and muscles, night sweats, shortness of breath, chest pain while breathing, swelling in your feet, legs, or abdomen, nausea, headaches, weight gain, and blood in the urine. And here's a picture of bacterial endocarditis under the microscope. And as you can see, it's gram-positive cocci. So I'll give you a minute to look at that. And here's a few pictures of what it looks like in the heart. Here's an actual picture of a real heart, and here's a cartoon version. Here you can see where the bacteria is up at the top and infected. It looks a little discolored. And over here you have free bacterial vegetation causing systemic embolus. That's up at the top here. And in the middle, it's bacterial infection on the valve. And then bacterial infection on the endocardial surface. So it can form really anywhere in the heart. I'll give you a minute to look at that. There are many ways of treating this because there are many different bacteria that can get into your bloodstream. So depending on what type of bacteria it is, your doctor most likely is going to prescribe you an antibiotic. Most of the time people will go to the hospital for this and stay about a week and be on an antibiotic IV drip, and then they will go home and receive home care. And sometimes surgery is necessary. Here are some common treatments for endocardial or bacterial endocarditis. Most of the treatments have penicillin in them. This one is penicillin and gentamicin. Penicillin is 18 to 30 million U per day, plus gentamicin 1 milligram for every 8 hours. This one's ampicillin and gentamicin, and ampicillin is 12 gram per day, and gentamicin is 1 milligram every 8 hours. The next one is vancomycin and gentamicin. Vancomycin is 15 milligram every 8 hours, and gentamicin is 1 milligram every 8 hours. And I got this information from the American Family Physician website. Penicillin is the most commonly used for this because it is a bacteria, and penicillin is commonly used because it kills bacteria through building of the lactam ring to D transpeptidase, inhibiting its cross-linking activity and preventing new cell wall formation. Without a cell wall, the bacteria's cell wall is vulnerable to water and molecular pressure, which causes the cell wall to die quickly. And this is why it's used, because it breaks down the cell wall, and then the bacteria is no longer. Here are some possible complications of bacterial endocarditis if not treated, and sometimes even if it is treated. It can include heart failure, valve damage, heart block, heart attack, brain abscesses, meningitis, stroke, seizures, and pulmonary embolism. And I got this information from Cedars Sinai. And that's it. Thank you.